I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Have you been sniffling and sneezing? Is your nose congested? Such symptoms could signal allergic reactions. This is the People's Pharmacy with Terry and Joe Graydon.
Seasonal allergies in the spring or fall are not the only ways our bodies react to the environment. Some people suffer year-round from pet dander or dust mites.
When you need emergency treatment, should you have an epinephrine injector handy at all times?
What are the dangers of common over-the-counter allergy treatments? Are there newer, more effective treatments?
Coming up on the People's Pharmacy, your allergy survival guide. What works, what doesn't, what's risky.
In the People's Pharmacy Health Headlines. According to the American Cancer Society, more than 300,000 women in this country will be diagnosed with breast cancer this year. For most of them, treatment will include chemotherapy along with hormonal therapy designed to block the effects of estrogen and progesterone on breast tumors. An international study has found that chemotherapy may not be necessary in some instances. More importantly, scientists have come up with a DNA test that can tell who will benefit from chemo and who probably will not. There were 4,000 newly diagnosed patients in the study, which was conducted in Thailand, New Zealand, Australia, Norway, Sweden, and the UK. The gene test, called Prosigna, determines the activity of 50 genes involved in the development of breast cancer. Women with low scores on the test were not treated with chemotherapy, just hormone therapy. After 5 years, 93.7% of them were still alive, almost indistinguishable from the 94.9% still alive after chemo plus hormone therapy. This development could mean that some women would not have to deal with the side effects of chemotherapy, which can sometimes be challenging and long-lasting.
There was more good news from the American Society of Clinical Oncology meeting in Chicago. An international study of 102 patients with resistant head and neck cancers produced promising results. Their cancers had become unresponsive to both immunotherapy and chemotherapy. They received a subcutaneous injection of a new drug called amivantamab. Almost half of these hard-to-treat patients experienced significant tumor shrinkage. In 15 cases, the cancer totally disappeared. In general, such cancers have a poor prognosis. That's why oncologists were encouraged by the response. There's hope that this new treatment might also work against lung, brain, and digestive tract cancers.
Another promising report from the ASCO meeting was the effects of a new drug for pancreatic cancer. Oncologists are calling daraxonrasib a game changer. Although not a cure, this daily pill doubled survival times for patients with pancreatic cancer. This trial involved 500 patients whose cancer had spread widely despite previous treatment. Researchers treated them with either chemotherapy or daraxonrasib. Those who received the new medication survived an average of 13 months, compared to 6.5 months for those on chemotherapy. Progression-free survival was also improved. It represents the first major improvement in treating this deadly cancer.
6 years ago, the world was struggling with the COVID pandemic. For many people, those dark days have faded to a dim memory, but too many others are still living with the consequences. A new study from Mass General Brigham finds that up to 1/6 of people who experienced a COVID infection may have lingering symptoms. The wide range of organ systems affected may make it difficult for doctors to recognize long COVID when they see it. Respiratory and gastrointestinal problems are common, along with systemic symptoms like brain fog and exhaustion. In New England, long COVID patients often have thyroid problems, whereas those in Texas are more prone to prediabetes. The researchers call for better diagnostic approaches, more coordinated care, and more effective treatment.
Warm weather means mosquitoes throughout much of the country. Perhaps it's time to get out the DEET. This has been the gold standard insect repellent for many decades. But now, mosquito researchers report mosquitoes can learn and flock to the aroma of DEET, usually providing a reward, warm blood. In a classic Pavlovian experiment, entomologists tested whether mosquitoes rewarded for biting a DEET-infused membrane would learn to prefer it. They did. Afterwards, they were presented with 2 human hands. One was coated in DEET and the other was not. Untrained mosquitoes avoided the hand with DEET, but those that had been trained made straight for the sprayed hand. According to senior author Clement Vinegar of Virginia Tech, mosquitoes' learning abilities could influence many more aspects of their daily lives than we currently think. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Many people think that allergies happen mostly in the spring or fall, but a lot of people experience allergic reactions throughout the year.
People can be allergic to something as simple and ubiquitous as dust mites, found in mattresses, pillows, upholstered furniture, or even stuffed animals. But some individuals have serious allergies to insect stings or certain medications. What can you do to manage allergies?
To learn more about what works for treating allergies, we turn to Dr. Kari Nadeau. Starting next month, she'll be dean of the UCLA Fielding School of Public Health. When we spoke with her, she was the John Rock Professor of Climate and Population Studies and chair of the Department of Environmental Health at the Harvard T.H. Chan School of Public Health. Dr. Nadeau was also director for the Allergy, Extreme Weather, and Exposomics Lab and professor of medicine at Harvard Medical School. She is co-author of The End of Food Allergy, which provides strategies for treating and preventing food allergies in children.
Welcome back to the People's Pharmacy, Dr. Kari Nadeau.
It's great to be back. It's a pleasure to speak with you again. Thank you for inviting me.
Well, thank you so much for joining us. Dr. Nadeau, I guess the first question I have, because you are at heart an allergist, why allergies? I mean, was this like a cosmic mistake? How come the body reacts to so many different things? There must be some reason.
It's a great question. Right now, we think there's 2 main reasons, and this is what I talk to my patients about all the time. First, having an allergy is rather prehistoric, like sea cucumbers have allergies. And it's important because if we get bitten by a mosquito or a fly or something attaches to our skin, or, for example, we get a parasite in our body, our body's immediate response is, let's itch, let's tell that person that that thing is on their skin, and let's try to get them to itch it and get it off of their skin. So those itching mechanisms are part of allergy. In addition, let's say we had a parasite in our lung or in our gut. Our initial response as humans are to just make lots of slippery mucus and get it out of there. So these are really old responses in our bodies to get rid of things that our bodies initially thought were foreign. Now, fast forward thousands of years, and our body still uses these old-time mechanisms to try to get rid of what we think is foreign. But unfortunately, now our body thinks that pollen is foreign. It thinks that food is foreign for some people. It thinks that different items that we want to make sure that we can use in our bodies, like drugs, some people have allergies to those too. So it's a very prehistoric mechanism to try to fend away foreign items, but now it's been skewed and now it's been used against those things that are not foes, that should be our friends, but unfortunately our body doesn't think so.
What astonishes me is there's such incredible variability between one person and another. So, for example, if Terry goes out into the garden and gets a chigger bite, it might itch just a little bit, but it's no big deal for her. Me, oh my goodness, if I get a chigger bite, not only is it red and itchy, but then it swells up, it lasts for weeks, it's unbearable. And I was like, why do I react to chigger bites like that? And Terry barely notices them.
Why are you such a delicate flower, Joe?
Yeah.
Well, Joe and Terry, this is a quintessential issue that we're always dealing with. And Joe, I'm sorry that you've had to deal with these things. And this is very typical. Some people are more sensitive, and that's actually, and just a silver lining here, that actually may be a good thing. My colleagues around the country have actually discovered that those people that have more responses to allergens or chigger bites, like you said, they secrete a certain chemical in their skin that actually reduces the chances of skin cancer. So there's some silver lining here. There might be a reason why we have these really strong responses. And like you said, some people respond more than others. And that to some extent is genetic, but to a lot of extent it's based on other factors like how stressed we are or what other infections we might have at the same time, or how old we are. Or if we've been exposed to something else in the environment, then it prompts us to be even more ready to have an allergic response. So there's a lot of different factors. Genetics isn't the only one, so don't blame your family. But we are learning a lot about why some people have more allergic response than another, and it might actually be beneficial.
Well, I would be interested in just kind of discussing the range of allergic reactions because as Joe pointed out, people can respond to the very same type of insult in quite different ways. But when we talk about allergy, I mean, there's a huge range of reactions and as well as a huge range of things that people react to. Can you kind of sketch out the landscape for us, please?
Sure. I like to sketch out the landscape in the landscape of the human body. And these allergies are very disabling, even though maybe a chemical could help us potentially fight skin cancer in the long run. No matter what, the chemicals that are secreted in allergies are quite disabling and they can be very dangerous. So that's why we take allergies so seriously. So the landscape from head to toe in any one individual can be allergies in the eyes. And typically, those occur when you're allergic to things like grasses or weeds, and people start feeling itchy eyes. But in very small circumstances or a very small set of the population, they can actually become blind. So that's why we take it seriously. You need to take your allergy meds for your eyes. Now let's go down to the landscape of the nose. The place where all that mucus is made when you have allergies to the environment, like pollens or cats or dogs or molds or dust mites, these two organs in your nose called the turbinates, they make a lot of mucus. People can make up to 1 gallon to 2 gallons of mucus a day. And your nose is literally on fire. It's congested, you're sneezing, you're putting out mucus outside of your nose, and you're ingesting it inside your body. A lot of that mucus goes to your sinuses, goes to your lungs, goes to your gut. And so that landscape is really tough for people. It's very disabling. It's a reason why a lot of people also get asthma because it dribbles down into your lungs and activates lungs so that they start squeezing and wheezing. So the lungs are the next landscape. A lot of people that have allergies also can get asthma. They also can get sinusitis because the mucus starts filling up our sinuses. And mucus is sugar water, and bacteria love to grow on sugar water. And so a lot of people with allergies also can get sinus infections. Now let's move down to the throat. Oftentimes when that mucus congests the area where the throat is inside our bodies, it also affects our voice. We tend to have a lot of coughing, for example, when we have allergies or it's allergy season. And then let's talk about the landscape of allergies in the gut. There are a lot of allergies in the gut. Unfortunately, food allergies, There's another disease that's associated with a certain cell type called eosinophils. And these are really disabling diseases. They oftentimes can cause full-blown anaphylaxis, which I'll talk about in a second, but they also can constrict what we call our esophagus, our feeding tube, and they can scar the feeding tube so much that we can't get food past. So these are allergic pathways that are not just nuisance diseases. These can be very disabling. So then let's talk about the whole body. When people have allergies to drugs or food, or there's a new disease called alpha-gal, which is to tick bites, and that can cause full-blown anaphylaxis from head to toe. And like I was saying, these responses were meant in the past to try to get rid of foes, but now they're very skewed, and unfortunately, they can lead to fatal or very near fatal results. It's very rare, but it can happen. And so if people have drug allergies or food allergies or allergies to bee stings that can cause full-blown anaphylaxis, they need to carry an injectable epinephrine device. And it's very rare to have full-blown anaphylaxis from head to toe. But with that, your heart is affected, your blood pressure drops, and that's why we take it so seriously, because anaphylaxis can happen in 10 minutes.
How would you know that you were beginning to experience anaphylaxis and needed that EpiPen shot?
Yeah. So when we say anaphylaxis, what we mean is 2 organs are involved. If one organ, like the skin, is involved and you have an insect bite and you have a large reaction, you start getting hives or an itchy rash throughout your body, you kind of want to wait. If all of a sudden now with your skin rash, you start breathing and you start wheezing, when that second organ is involved, again, something different from the skin, you use an epi. And for example, if you had any breathing issues that you were really grasping for air, your breath is so important to you. And without oxygen, we can pass out. So even just wheezing, you give yourself an epi. And the other reason to give yourself an epi is dizziness. If you're dizziness and you know you've been stung by a bee or you know you've eaten a food that you're allergic to and you're dizzy, you give yourself an EpiPen. So 3 reasons. When 2 organs or more are involved. The second is if you're having breathing difficulty. And the third is if you're dizzy.
You're listening to Dr. Kari Nadeau, incoming dean of the UCLA Fielding School of Public Health. She's an adjunct professor at Stanford Medical School. Dr. Nadeau is co-author of The End of Food Allergy, the science-based plan that turns food into medicine.
After the break, we'll talk more about what to do about drug allergies. How can you tell if you're allergic to a medicine?
Some people react badly to ACE inhibitors like lisinopril. If so, they need emergency treatment.
How is that different from contact dermatitis like poison ivy?
What other treatments does an allergist like Dr. Nadeau have in her toolbox?
We'll hear about desensitizing shots and acoustic resonance therapy.
Some days call for some oomph to amplify your everyday look. Like when you want the look of false lashes without the extra effort. Reach for Thrive Causemetics Liquid Lash Volumizer Mascara. Or when you want all eyes on your smile, keep Empower Gloss Ultra Glossy Lip Serum in your bag. It's a burst of 24-hour hydration that smooths like a serum, shines like a gloss, and can be worn sheer or layered. You'll also look and feel your best with Thrive Causemetics. Plus, every product is 100% vegan, cruelty-free, and made with clean, skin-loving ingredients that work with your skin, not against it. And for every product purchased, Thrive Causemetics donates to help communities thrive. So every time you use your favorite Thrive Causemetics product, you're helping communities you care about too. Amplify your everyday. Go to thrivecosmetics.com/shine26 for an exclusive offer of 20% off your first order. That's Thrive Cosmetics, CAUSEMETICS.com/shine26.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids this allergy season. More at getsonu.com. That's getsonu.com.
We're talking about allergies today. They can range from a mild annoyance to a life-threatening emergency.
To help us understand what works and what doesn't, we are talking with Dr. Kari Nadeau. She is incoming dean of the UCLA Fielding School of Public Health. She's been chair of the Department of Environmental Health at Harvard's T.H. Chan School of Public Health, and she's an adjunct professor at Stanford Medical School. Dr. Nadeau is co-author of The End of Food Allergy, the science-based plan that turns food into medicine.
Dr. Nadeau, I'd like to talk a little bit about pharmaceutical allergies, and I'm going to give you a couple of questions in a row, and I apologize for that, but nothing drives me crazier than watching a TV commercial where they say, if you're allergic to this wonderful, brand new, fabulous medication that's supposed to be good for, I don't know, psoriasis or asthma or goodness knows what, don't take this drug. Well, how would you know that you're allergic to this wonderful new drug if you've never taken it? The only way you can find out is to take it and then, oh my goodness, I'm allergic. I'm in trouble. I need my EpiPen. But you can't know that in advance.
That is such a smart question, Joe. Of course, all of those label claims are put there to try to help people be informed. But whenever you're informed about anything in life, you always want to weigh the risks to the benefit. And so when you're weighing the risks to the benefit, please contact your doctor. Please contact a healthcare professional who is trained. Don't necessarily chat with a chatbot about these things. The allergies to pharmaceuticals, as you know, are really rare. Like, it happens, but it's 1 in a million. And most people that are allergic to drugs can be allergic to other drugs. So you kind of already know if you're someone that is drug allergic.
Well, I'm going to interrupt you on that one because there is a class of medications called ACE inhibitors. These are the number one most prescribed blood pressure drugs in this country, and lisinopril is by far the most popular. And any emergency department in the country, if you show up with a swollen lips or a swollen tongue or difficulty breathing, they're going to ask, are you taking lisinopril or some other ACE inhibitor? Because it's a fairly common, it's uncommon, but they see it quite frequently in emergency departments. And what's really scary about this ACE inhibitor allergic angioedema reaction is that it can come on well after you started the medicine. So you could be taking lisinopril for 6 months or 6 years and all of a sudden develop a life-threatening allergy. And if you haven't been warned, you may not know what's going on.
That's right. So those people are the ones where I would also be careful, because if you've taken lisinopril and you've had a reaction like that, then if you're going to start a new chemotherapy agent or get a new antibiotic, you know that your cells are already in an itchy state. You have a low threshold for reacting to drugs in general. There's no genetics, there's no gene we can test for this. It's just that you have what we call twitchy cells that react. Now, that's really tough to say to a patient, because you're right in your original question, like, how do you know who those people are? We don't know who they are yet. However, what we can do scientifically is break down how people react to medicines. There's one that is like an allergy, where they actually make a molecule called IgE that is the match that lights the fire behind allergies. So that's like penicillin allergies, sulfa allergies. That's where sometimes even the first time you can blow up, have anaphylaxis. Then there's another type of allergy, like you're saying for lisinopril, where some medications, it takes a long time. You're taking them and you're just fine and you're not having reactions. Then all of a sudden, they start making you swell up. And that's a different type of chemistry. That's a different type of immune activation, but we take it very seriously because swelling can cause swelling in the airway, and we never want that. So that's why we tell those people avoid lisinopril. That's why we tell people when they take, sometimes people get red man syndrome when people take something called vancomycin. And that's a different chemical reaction. It's not necessarily this molecule that lights the fire behind allergies, the IgE. You can't find IgE to lisinopril. You can't find IgE to vancomycin, but they do cause a lot of swelling, so we tell people to stop. Then there's a third category, and some people and the pharmaceutical industry will call the third category allergies, but they're really not. They're sensitivities. They're just side effects. And it's the typical side effect. For example, when you take erythromycin, you're going to get a stomach ache. A lot of people do. And that's just a side effect of the drug. That's not an allergy. But people confuse it. That doesn't mean you're going to have an anaphylactic reaction to erythromycin, though. And that's really important because compared to penicillin allergy, where you could have an anaphylactic reaction, side effects to drugs, you're not going to have anaphylaxis. Does that help?
Yes, and this last idea of sensitivities, I'm thinking contact dermatitis, like poison ivy. We talk about being allergic to poison ivy, but my understanding is it's really a contact dermatitis. Is that right?
Yeah, great question. So we talked about these three categories of allergies to drugs. And again, that third category really is an allergy, but it's all lumped in. And that's why when you read the TV commercial or you read those commercials, just go talk to a healthcare professional because you might really be a great candidate for that drug. And we want you to be able to have it because it could benefit you compared to the risks. But now let's move on to other things in the environment like poison ivy. And I'm sure maybe the listeners will remember that when you rub against a poison ivy, or sometimes when you get bitten by an insect, you might not get that welt or you might not feel that poison ivy on your skin until about 2 to 3 days later. And that is a different type of allergy. That's actually made by a different cell. And it's not fun. And you can still have terrible contact dermatitis, like you're saying. But your cells remember that. So the next time you get exposed to poison ivy, it'll actually have a worse response. So it's not anaphylaxis, but it does activate an allergy cell so that it can worsen over time.
Can we talk about treatment?
Absolutely.
I think during allergy season, people just really would like a way to not be so miserable.
And I want to interrupt the idea of allergy season because when I was growing up, I had allergies. So come the spring and come the fall, the ragweed season, I would sneeze 20, 30, 40 times before I'd get out of bed in the morning. But then as soon as the first frost came in the wintertime, no more allergies. And so I was fine until spring. But these days, people complain about allergies all year round. And some of them are reacting to, I know it's not bed mites, they're dust mites. They live in our mattresses and in our pillows and in our furniture. And so they're there all year round. And there are lots of people who are just allergic all the time. It's not like, oh, for 2 weeks I can live with this. It's like, help, Dr. Nadeau, this is not working for me. I can't function because I'm spaced out. Even driving is dangerous if I start sneezing. So help us understand the approach that you would go through from the antihistamines to the corticosteroids to all of the arrows in your quiver.
Absolutely. And let me just pause. Now, you might have some listeners that say, oh, I don't have allergies. I don't have to worry about this. But unfortunately, about 30% of the population will have allergies at some point in your life. 30%, 1 out of 3. And with those allergies, you can get them at different times of your life. You might not have had them when you were a child or when you were an adult, but then when you get to over 65 and and become what I would call wise in your age, you could start developing allergies. So just for your listeners to know, please take these recommendations because you never know if you could have allergies or not. It's not like they're all predefined in childhood, unfortunately. And then, like you mentioned, Joe, you can have allergies any time of the year. What people are allergic to are things in the environment. So those could be insects, and they can occur, and especially with people traveling, insects are everywhere, and we come in and out of different seasons depending upon where we travel. In addition, the globe is getting warmer, so now we're seeing a lot more insects and pollen than we did in the past. And when it comes to winter, you might think, oh, great, the plants are frozen. I'm not going to have pollen. But then there are people that have allergies to dust mites, and dust mites are in our houses. It's very hard to get rid of dust mites, and you're allergic to them. And so there are people that only have allergies in the wintertime because dust mites increase in the winter. So what I tell people is get diagnosed, go to an allergist, find out what you're allergic to, and then you can put a personalized plan together to have anticipatory guidance. If you have allergies to grass, okay, you know that grass season in your neck of the woods is probably going to be from April to June. If you have allergies to oak, okay, if you're in California, you could have an allergy season that starts in February. So personalize your season. There are some people, like you mentioned, Joe, that they have so many allergies, they span the entire year. So let's talk about therapy. Again, head to toe. There's different types of therapy. And I want to make sure everyone knows who's listening that any one of these therapies does not get you to zero. It is not a perfect cure. And that's important because, like I mentioned on this broadcast, these are disabling and we really need to do better. That's why we need research. That's why we need more science. That's why we need to understand why allergies are increasing, and they're increasing to things that we thought we didn't have to worry about, like sesame seed or egg. But with that, the therapies are specific to what you're allergic to. So many of you might have heard there's allergy shots. For a long time, for 100 years, if we can take what you're allergic to, again, personalized medicine, we take the allergens that you're allergic to, put them in a special syringe, and we dose that very carefully, and we dose it ever so often. As an allergist, you have to have a licensed allergist do this, and you will get desensitized over time to your allergy. That's the only known mechanism that you can actually reverse your allergies. Then
And Dr. Nadeau, let me just say, as a child, I mentioned that I had allergies.
yes.
I got shots all the way through till college. And after that, I was done with my allergies and done with my asthma. It worked.
Okay, well, great. You're one of those people that it did work in. It works in about 25% of people in a permanent way like that. So I'm so glad for you, Joe. It's worth trying because it's worth that 25%. In other people, it kind of reduces it while you're on it. And then when you stop it, they come back. And other people, it doesn't do anything. And so I think importantly is that we want to give people choices. And you do have choices. So talk to an allergist, get your allergies diagnosed, find out about immunotherapy. There's other immunotherapy now, for example, for food allergies. You can do the same thing, but not through a shot, through oral immunotherapy. That's been going on for a while now. So that really tries to change your allergies through immune education, I'll call it. But let's say it's pollen season, you have terrible allergies, you can't get on that airplane because you're so congested, or you can't go to work because you're sneezing so much, your eyes are all swollen. You go down the aisle of your local pharmacy, and the aisles now are increasing in the number of over-the-counter medicines. And so let's go head to toe in terms of those types of therapies. First, there's eye drops. And I don't work for any of these companies, but there's eye drops that say that they are allergy eye drops, and those are very helpful. So you want to use those to just relieve your eye itchiness and eye swelling. Then there's nasal sprays. You want to use those as well because they can help reduce the swelling in your nose and they can help you stop sneezing as well. And those are things like Flonase or Astepro. And again, those are all over the counter. Then, in addition, like I said, that mucus can really get congested in the sinuses, and that is not fun. That affects your sleep, and that can give you infections. So, there's actually a nasal wash that you can get if you like it. People use it right before they go to sleep, for example, so they wash out their sinuses and get that mucus away before they sleep. Some people use it in the morning too. Then there's actually a type of product called acoustic resonance where you can put a band around your forehead and it can actually jostle the mucus and get rid of that mucus out of your sinuses, and people feel a lot better. It also helps with your sleep and it can help children. It can help, it's not a medicine. So it really helps a lot with different aspects of your allergies. So the next thing is oral. And when we think about what we can take through our mouth, there are a lot of antihistamines, like you mentioned, Joe. But be careful. Some antihistamines will make you sleepy. So you need to test these on the weekend, for example, when you're not working, when you're not maybe driving in the next 5 hours. But there are a lot of antihistamines out there. Use the right one. There is something called Zyrtec. There's something called Claritin. There's something called Allegra. There's an old one called Benadryl. But make sure that you understand how they can affect drowsiness. And some of them do have side effects. So we try to do everything locally: eye drops, nose sprays, skin care, creams to help allergies, and to make sure that you don't have a lot of contact dermatitis, for example. But the oral medicines oftentimes help too. So if you have asthma, the other medicine to take through the mouth is basically any kind of inhaler. And so talk to your doctor about that. Those can help as well. But in total, for anyone with allergy, again, from head to toe, I'm talking about all the therapies, and those are all over the counter. You can buy them. They can have a substantial effect, but only about 35% improvement. So even if you do full court press, which I recommend everyone do because 35% is better than nothing, but all of those medications are only going to give you about 35% reprieve of your allergies.
We're going to take a short break, Dr. Nadeau, if you don't mind. When we
Sure.
come back, we'll talk about some of the complications of those over-the-counter medications, and then Plan B, what your allergist can do for you.
Perfect. Thank you.
You're listening to Dr. Kari Nadeau, soon to be Dean of the UCLA Fielding School of Public Health. She has been the John Rock Professor of Climate and Population Studies and Director of the Allergy, Extreme Weather, and Exposomics Lab in the Harvard T.H. Chan School of Public Health. Dr. Nadeau is also author of The End of Food Allergy, the science-based plan that turns food into medicine.
After the break, we'll consider the possible downsides of relying heavily on some over-the-counter antihistamines, especially diphenhydramine.
Some antihistamines, including Zyrtec, can cause horrific itching when a person stops taking them.
We'll learn more about a new device that uses acoustic resonance to clear congested sinuses.
Which medicines are most effective for difficult cases?
What's the role of the environment? Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Sonu, an FDA-approved drug-free treatment for nasal congestion and runny nose, using sound instead of steroids this allergy season. More at getsonu.com. That's getsonu.com.
Today we're talking about allergies. Many people believe that oral antihistamines are the primary way to treat allergy symptoms, but are there downsides to some of these medications?
what about newer treatments such as Xolair or Dupixent? How effective are these high-tech medicines?
We're talking with Dr. Kari Nadeau. Starting next month, she'll be Dean of the UCLA Fielding School of Public Health. She's co-author of The End of Food Allergy, the science-based plan that turns food into medicine. This book provides strategies for treating and preventing food allergies in children.
Dr. Nadeau, we have just heard a wide panoply of mostly over-the-counter treatments that people can use to help reduce the burden of allergies. But some of these treatments, probably almost all of these treatments, have some side effects. There are some that we worry more about, and I'm wondering if you can tell me, am I being foolish to worry about the potential for a drug like diphenhydramine, Benadryl, or also it's the PM in your PM pain medicines? I worry that it could put people at risk for dementia later in life.
That's an excellent question. And you're not being foolish at all. These are serious questions. People on the listening audience right now probably remember that if they take Benadryl, sometimes they feel sleepy, but they also might get really dry mouth. And these affect neurons. They affect our nervous system in ways that we have to be super careful about. Because if you take chronic diphenhydramine or Benadryl, what's been shown now is that it could increase the risk of dementia. It does affect our nervous system in ways that we really want to make sure we be careful about. So I would tell all the people that are suffering through allergy, please be careful as to which medicines you're taking. The ones that we call second generations or antihistamines that came out after Benadryl came out tend to be safer. They tend not to affect the nervous system, but they can still have you cause dry mouth. And like you said, Terry, PM is oftentimes given in our cold medicine, but PM means that they've put something in there to make you a little sleepy. And when you make your nervous system a little sleepy, if you take that too much over time chronically, perhaps it also creates dementia. So that's why we got to be very careful about these meds. Now, there's even medicines that are older than Benadryl, like hydroxyzine. And that one people can take if they have really bad itchy skin or eczema that keeps them up at night. But I wouldn't want to do that regularly. I want to be super careful. And then in the antihistamines, there's always new ones out there on the market. Be careful. Talk to your doctor before you take them. There's Zyrtec, there's Claritin, there's Allegra. Allegra is not supposed to make you sleepy, but we should always be careful because when sometimes you stop these medicines, they can cause you to have worse allergies. So what I tell my patients is oftentimes take 2 weeks of Zyrtec, then 2 weeks of Claritin, then 2 weeks of Allegra. And that way keep switching it around
Well,
so that if you do stop one, you don't have a bad reaction. Yes,
Dr.
go ahead.
Nadeau,
Sorry, Joe.
we did discover that a couple of those newer generation antihistamines, one is called Zizal and the other one is
the Zyrtec.
Zyrtec.
They are actually closely related, but they're not as closely related to all the others you were mentioning.
Right. But when people have been on them for several months, for example, during quote unquote allergy season, and then they stop suddenly, some people complain about itchy skin, and that sometimes can last for 2 or 3 weeks, and it can be quite unbearable. And they, if they start taking the Zyrtec or the Zizal again, the itching goes away immediately, and they go, oh, that's kind of weird. How am I going to stop this?
We have received hundreds of reports of people who have experienced this, and we bugged the FDA to let people know about it. And they did eventually add it to the prescribing information. So a doctor who prescribes these will have that heads up if they read all the details. But it's not... most people take this over the counter, and it's not really obvious in the over the counter information.
I'm so glad that you both are helping advocate, not just for individuals that you're educating through this program, but you also for the population. So thank you for talking to the FDA. I appreciate that because your experience and your expertise needs to help everyone. And I agree with you. I also have seen that on an individual basis as a doctor with my patients. So I hope people are listening here and know how careful they have to be with these oral medicines, but yet they're helpful. But you have to be careful when you go off of them.
Now, briefly, corticosteroids are magic. They relieve inflammation. They're really marvelous, but people can get into a corticosteroid habit because the nasal sprays work so well. And I just worry about year in and year out and decade in and decade out, and the possibility that, some people may eventually end up with weaker bones, with some of the other long-term effects of corticosteroids if they've taken them for, literally for decades. We're wondering about that sound thing you mentioned around your head.
The acoustic resonance.
What is
Yes,
that and how does
exactly.
that work?
Sure. Like anything, we should always minimize medications and maximize effect. And when we have a medication that we're using and it could cause a side effect, we should look to see if there's something easier and perhaps mechanical or that's a device that doesn't include a medication, that doesn't include a synthetic chemical. Like you said, giving steroids all the time, and even though the nasal steroids, they do work, they can get taken up by your body. If you use them chronically over time, they have shown that it can reduce your height in terms of growing if you're a child. So these medicines that help your allergies are helpful, but because they're chemicals, they can affect your body and they're not natural chemicals. And so steroids affect your immune system. Antihistamines, we just talked about, they can affect your nervous system. So now let's talk about those things you might really be able to take that don't include medicines. And so people have now studied, and includes my own research with colleagues at a company called Sound Health and a man by the name of Peter Huang, who's an ENT surgeon at Stanford University. They developed a band across the forehead that is safe, can be used at night, and it basically vibrates very slowly without a lot of irritation to be able to take that mucus that gets clogged in your sinuses and then bring it down to be able to have it be absorbed by your body naturally. And the studies have shown a lot of improvement in allergies. And I was really interested in this. So that's why I decided to join the study because I thought, oh, this might help my patients. It will minimize medications and maximize effect and help them sleep and help reduce their allergies.
And Dr. Nadeau, we need to disclose that we have had a relationship with Sound Health. They have underwritten the People's Pharmacy radio show and podcast. Do you also have a financial relationship with the company?
Thank you for asking that. When they asked me to join as an advisor to look at their data, they did offer stock options to me. So I do have stock options, but they're not worth anything right now, if that helps you.
Yes, thank you. Oh, we just need to have that all out in the open so that listeners know exactly where we all stand.
I do want
Thank
to
you.
ask you about oral medicine because there is a medicine, and I'm forgetting about it because it's often prescribed for asthma, not so much for allergies, but it has psychological side effects that weren't discovered until many years later. Terry, do you remember what that was?
I don't. Was it perhaps Xolair, or is that something else?
Um, great. It's called Montelukast.
There you
That's the
go. That's it.
one. You got that.
It's but you're right, Terry. It has that singular. It's called singular. So it's not Xolair. We'll talk about Xolair in a second.
Okay.
But there was a product that inhibited a certain pathway associated with allergies. And It helped some people, but unfortunately, it also had some psychological effects, side effects. And so right now we have reduced our use of it. And I think it's really important, like you mentioned, Joe, when side effects come out in the general population, we need to really keep track of them because our mantra is to do no harm. And so getting information like what you're doing at the People's Pharmacy, like this information comes in over time and we need to readjust and change what we're giving our patients and what our patients are taking and what they're deciding to buy because of this information that comes in either yearly or sometimes it takes some years to figure out what these side effects are.
So, Dr. Nadeau, we have about 5 minutes left, and I'd like to talk about the heavy artillery that you have when
Sure.
over-the-counter medications no longer do the job. But I also want to talk about the environment because the rooms that we live in, our houses, and of course the exterior when we go out into the world and there's pollen, we can actually impact our environment and how we interact with it. So first, give us the heavy artillery that allergists such as yourself can utilize when necessary, and then sort of in a more general way, what we can do to reduce our risk of developing allergies or even minimize the reactions so that we don't necessarily have to rely on so many medicines.
Thank you, Joe. Excellent question. So, like I said, when you take over-the-counter medicines, they can work about 35% to improve your symptoms, but it's not getting down to zero. There are some of my patients, when they take heavy hitters like Xolair or Dupilumab or Dupixent, these are new medicines that have a lot of hope and promise. They were designed with science in mind. They were designed over years. Xolair has been out for over 30 years for asthma. It really does inhibit that match that lights the fire behind allergies, so it's quite effective in different allergies. In addition, there's another drug called Dupixent that goes even up above the pathway of the match that lights the fire called IL-4. And what's great is that these are now in my armamentarium to give to patients that fail these other therapies that we talked about. And I let them know that these two drugs are available to them and they can get them at home. They need insurance to pay for them. And that's really important. So you can't get them until you know that you've failed these other methods. But I use them a lot now, and I'm excited about their use because for some of my patients, they have helped out tremendously. They have felt like their allergies are cured, their asthma is cured, and I'm excited about that.
Could you just mention those names one more time for people who may not have caught them the first time and how they're spelled?
Sure. The commercial name of one of them is called Xolair, Xolair. The common name for it is omalizumab. You can look it up. It's made by companies like Genentech and Novartis and Roche. The second one is called Dupilumab. That's its common name. And its commercial name is Dupixent, Dupixent. That's made by a company called Regeneron, and then also Sanofi has licensed it for some diseases. So those two are the big players on the block. There's some others as well, but importantly, those are the ones that I now can come into my toolkit when I'm trying to help patients, which is great.
And we'll include those names in the show notes.
Okay, great. Thank you. For the environment, we play a critical role in how our environment is shaping in the future and now. I would say that number one, for an individual, know what your allergies are to. So that if you have allergies to pollens and you have to mow the lawn for some reason and you're allergic to grass, wear a mask. Like you can really reduce your pollen intake of any pollen by wearing an N95 mask. So you can do something about it. But the first thing would be get someone else to mow your lawn if you're allergic to grass.
Right.
The second thing is allergies oftentimes are worsened with air pollution. In fact, air pollution is like a carrier for little pollens, and pollens are a carrier for air pollution. You can, like, they're little sponges for particulates in the air. When I look under the microscope at a pollen in an air pollution prone area, I can see the air pollution stuck to the pollen.
Mm-hmm.
So please, first of all, we can all do better at reducing our reliance upon fossil fuels, but that's another whole topic. But importantly is try to avoid those days that are pollution high in the sky. When you look outside, you can look at air quality indices. You can look at pollen counts. That's helpful. Those are all available online.
And your weather app might tell you about the level of air pollution.
Exactly. So the third thing I want to really mention is that 9 breaths out of 10 in our lives as humans right now are spent indoors. So we spend about 90% of our lives indoors. And so to have HEPA filters that can filter out pollens and other toxins like pollution is really important. There's a grade of filter called a MERV 13 filter. And if you go higher in the numbers, it even gets out more. So things like that will help your indoor living as well.
Dr. Nadeau, I'd like to ask you about a medication that's available over the counter that has seemingly been forgotten both by patients as well as health professionals. And that's a drug called nasal chrome. It was originally developed for asthma. I believe, and I could be wrong about this, that the brand name was Intal.
Yes.
But it is now available only for nasal allergies, and people can use it as a nasal spray. And it is available, but most pharmacies don't carry it. It's what we call a mast cell stabilizer. And a lot of the allergists that we've talked to over the years go, oh, it's not worth it because you have to use it 3 or 4 times a day and nobody wants to do that. And you have to get ahead of the allergy problem. Like if you're going to visit your cousin Charlie and cousin Charlie has a cat, you have to use the nasal chrome, a day or 2 before you go see cousin Charlie, and nobody wants to do that. But I kind of like nasal chrome because it seems super safe and it seems fairly effective.
And I think probably the allergist perception that nobody wants to do that is nobody who comes to see them wants to do that, because the people who are using the nasal chrome, and we do have people write comments on our website, I use this stuff and it's great. So they don't have to go to the allergist then.
Right. So, Dr. Nadeau, tell us a little bit about mast cells and a little bit about nasal chrome.
Yeah, thank you. Great question. And yes, I believe in nasochrome, and yes, I have used it. And I always offer it to patients as we talk about their choices, and we always talk about pros and cons. So first, mast cells. There are some bad actor allergy cells. The mast cells are one of them. And I was mentioning the match that lights the fire behind allergy called IgE. That docks into the spaceship, i.e. the cell of the mast cell. And the minute it docks into that mast cell splurges, opens up, and the histamines come plowing out. And they just secrete lots of chemicals associated with allergies. And so this chemical called cromolyn sodium, which is part of nasochrome or Intal, it stabilizes those mast cells so they don't break open. So when that IgE kind of floats by, they just kind of stay peaceful and quiet. And that's helpful for people that have mast cell activation syndrome, that have mast cells activated during allergies. And it takes some time to convince our mast cells to become peaceful. So that's why you need to take it ahead of time. But that's okay. A lot of our patients are quite motivated to do that. So yes, I'll use nasochrome. It's relatively safe. Some people get an upset stomach with it, but in general, it is an other option for people with allergies.
Dr. Nadeau, much earlier in our conversation, you briefly mentioned alpha-gal as a form in which allergy may present. And I think that we didn't have time to talk about it during the show, but some of our listeners are more than familiar with alpha-gal. Many are not. Could you please tell us what is this and what needs to be done about it?
And how do people develop this allergy?
It's a great, great question. And I can say when I was a child, I had terrible allergies, but it wasn't to alpha-gal. Like, this is a new allergy. And I think that there will likely be new allergies even beyond this one. So we always have to keep our ear to the ground and really watch out for these types of things. So I'm going to tell you specifically some of the answers to your questions about alpha-gal, but just this is all in the context of the fact that we always have to be alert to allergies that people are forming new reactions to that we otherwise didn't learn about. So that's what I love about my field. It keeps you on your toes because we have to help people and we have to know what they're allergic to. So alpha-gal was recently discovered within the last 25 years. And unfortunately, it's something that is a complex reaction to a complex cycle. Typically, you have a tick, and that's called the Lone Star tick. And that Lone Star tick has saliva. And when it bites and it has a certain sugar in there, and that's what the alpha-gal stands for. It's a type of sugar. It's not the type of sugar you put in your tea or your coffee. It's a different type of sugar, but it is a sugar that can happen and occur in, let's say, meat or beef. Beef, yes, it's mostly muscle, it's mostly protein, but there's sugars in there too. And then there's some medicines like chemotherapy that also have this sugar. It's a very rare type of sugar. So in the meantime, the tick does the biting, unfortunately. When its saliva is kind of chewing it up, it changes the sugar to a degree by which then our immune system, once it bites us, it thinks, uh-oh, this is an allergy. I better respond to it. So with that in mind, a lot of the symptoms are diarrhea, they're gut. So there are different types of allergy symptoms, but we take it very seriously because it can also cause problems that are very severe. So this disease, like you said, was first identified near and around Virginia and the southeast part of our country because that's where the Lone Star tick was habitating. That's where its grounds were, especially in the southeast, in the southern part of the eastern aspect of our country. But now, again, a lot of it potentially due to the warming of our planet. Now that Lone Star tick is migrating to other areas too that used not to have the Lone Star tick. And so now we're seeing alpha-gal increase across the US, for example. So people need to take this seriously. There's no known therapy right now. And so if you feel like when you eat meat, and this is real meat, this is not like a plant-based meat, this is beef, that
Beef or pork or lamb or anything that
exactly.
came from a mammal.
Exactly,
But
a
chicken
mammal.
and fish are fine.
That's right. Chicken or fish are fine. So beef, other mammal proteins, like you just said, Terry, thank you. If you have reactions within about 4 to 6 hours, please go see your doctor because they can at least tell you how to minimize your exposure.
Dr. Nadeau, we have heard that your colleagues made a colossal mistake a couple of decades ago when they said, in essence, well, babies should not be exposed to peanuts because peanut allergy is a really scary thing for kids, and the solution is avoid peanuts at all cost. And it turns out that advice was wrong. Can you give us a little sense of what happened and what the current thinking is?
Sure, absolutely. And this was a little bit before my time when I went into training. And and it is true, Joe, like this is a group of well-meaning people. These are doctors that really cared about their patients. And food allergy was increasing around the planet. And They were all worried. They all cared about their patients very much. And the only tool they had in their tool chest, because research hadn't been funded yet, NIH didn't have money to give to research in food allergy prevention. So the only tool they had in their tool chest, because the American public, the public around the world were saying, what should we do? What should we do? And so they came into a committee and they said, okay, at least for now, because we know that some of these are developing in childhood, like milk and egg allergies, and that can lead to peanut allergies, like you mentioned. That's a very serious one, as well as other foods. They said, okay, let's just avoid those foods. Let's see what happens and try to prevent these allergy activity in infancy. And maybe if we can reduce that exposure during infancy, we can just then not have it later in life. But unfortunately, that hypothesis turned out to be wrong. So again, they're well-meaning. They didn't have a lot of research data. They did the best they could with the data they had. But to their credit, they said, wait a minute, we really need to study this. We need to study if this is correct or not. And there were countries where babies were eating peanuts without a problem. In fact, they were eating this little bamba like early on. And those countries didn't have peanut allergies. So my colleague, again, being insightful as a scientist, you always have to be really good at observation. We realized that those countries that had actually started feeding their babies different foods, instead of avoiding them, actually feeding them regularly in small amounts, that those were the countries that had the least amount of food allergies. So people pivoted, the science got done, the research got done rigorously to prove now without a doubt that starting earlier and often is much better to train the immune system to not be allergic. Now, that's not the only way to train the immune system. There's other ways too, but we need to think about all this as a really good learning pathway for how to adjust our recommendations based on science.
Dr. Kari Nadeau, thank you so much for talking with us on the People's Pharmacy today.
Thank you.
You've been listening to Dr. Kari Nadeau, incoming dean of the UCLA Fielding School of Public Health. She was chair of the Department of Environmental Health at Harvard's T.H. Chan School of Public Health, and she is an adjunct professor at Stanford Medical School. Dr. Nadeau is co-author of The End of Food Allergy, the science-based plan that turns food into medicine.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Today's show is number 1475. You can find it online at peoplespharmacy.com. That's where you can share your comments about this episode. You can also reach us through email, radio@peoplespharmacy.com. This week, you'll find additional information about nasal chrome. It's a medication you can buy over the counter, and its effect on mast cells, as well as alpha-gal allergies and the latest thinking on preventing peanut allergies in youngsters.
Our interviews are available through your favorite podcast provider. You'll find the podcast on our website on Monday morning.
At peoplespharmacy.com, you can sign up for our free online newsletter to get the latest news about important health stories. When you subscribe, you also have regular access to information about our weekly podcast. If you always wondered what we look like or wanted to watch our guests as well as listen to them, we've started posting our video podcasts on YouTube. Just search for People's Pharmacy.
If you enjoy the People's Pharmacy podcast, we'd be grateful if you wrote a review of the People's Pharmacy and posted on the podcast platform. If you find our topics thought-provoking, please share them.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week. Thank you for listening to the People's Pharmacy podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.